As a health plan or employer, your goal is simple. Reduce costs while providing quality healthcare benefits. Maybe it's time to try something completely different. FlexCare is a service that connects members to U.S. board-certified physicians through phone or online video consultation. Doctors listen carefully, make a diagnosis, and prescribe medicine when appropriate. Doctors even offer the option to inform the patient's primary care physician about the consult through continuity of care records. These doctors average 15 years of experience and are licensed in a variety of disciplines. Now, why should you try it? These are 5 reasons for telehealth. Reason 1, telehealth is needed. There is an increasing trend of emergency room overutilization. Patient access barriers are to blame. As a result, healthcare costs are expected to increase 5.2% in 2014. At the same time, there is a national shortage of primary care physicians. Healthcare reform is expected to add 30 million new people into the health insurance pool. This is good news for those getting covered, but bad news for an already taxed primary care system. Low-cost, innovative solutions are needed now more than ever. Reason 2, telehealth saves you money. Patients visiting an emergency room or urgent care clinic for non-emergency medical care cost everyone a lot of money. The cost for a trip to the ER can be $750 or more. With FlexCare, there are no consultation fees. The member will receive a callback from the doctor in an average of 22 minutes. Think of all that time employees miss work to get treated for routine illnesses. Reason 3, telehealth is flexible. At any point in the year, telehealth can be implemented in as little as 10 days, depending on the level of integration needed by the customer. Telehealth integrates with all types of health insurance companies, benefit designs, copays, and deductibles to interest-specific population needs. And when implemented, we are not going anywhere. We'll partner with you to help drive appropriate utilization. Members will receive the right care at the right price. Reason 4, telehealth works. A large retailer with over 2,700 store locations and over 12,000 employees nationwide implemented a telehealth program on January 1, 2011. In 1 year, over 2,900 consults were performed for their employees. 47% of those consults would have resulted in an ER, urgent care, or specialist visit. By redirecting non-emergency care to the proper channels, the retailer estimated an annual cost savings of over $500,000. Reason 5, telehealth is quality. In a full decade, telehealth has never stopped improving. 97% of customers surveyed are satisfied with their service and the individual physician who they consulted with. 91% of patients said their medical issue was resolved. Telehealth doctors are U.S. board-certified physicians licensed in their respective states, and these doctors are credentialed every 3 years according to the NCQA standards. Telehealth is one of the fastest-growing industries in the nation. It's been around for 10 years, millions of members, and growing. So these are the 5 reasons to give telehealth a try. We'll leave the rest of the reasons for you to discover. Contact FlexCare today to get started.